Welcome to Vital Terms, the medical terminology podcast brought to you by Language Access Academy. In this episode, we'll delve into the fascinating world of the ear, exploring essential medical terms related to this incredible organ. Let's get started. Our journey begins with the term ENT, also known as otorhinolaryngology. And ENT doctor is also called otolaryngologist or otorhinolaryngologist. Don't be scared by this insanely long and tongue-twisting word. It's actually not that difficult once you break it down. Oto comes from Greek, meaning ear. So anything related to oto involves the ear. Rhino comes from Greek, meaning nose. Think about the wild animal rhino, and you know why it means nose, right? Laryngo is derived from Greek, referring to the throat or voice box, also known as the larynx. So when you put it all together, otorhinolaryngology is the study of the ear, nose, and throat. So, be sure to subscribe to this channel if you haven't. We will have a series of episodes on word origins, roots, prefixes, and suffixes, which will multiply your efficiency in learning medical terms. Did you know that the ear is not just for hearing, but also plays a crucial role in balance? It's like having a built-in gyroscope. Earlobe is the soft, fleshy, pendulous lower part of the external ear. It's the part we often pierce for earrings. Fun fact, earlobes are unique to each person, just like fingerprints. The external ear, or outer ear, is the visible part of the ear that extends to the eardrum. It's like the ear's outer shell, capturing sound waves. Did you know that the shape of your outer ear helps you determine the direction of sound? Ear canal is the tube-like passage through which sound enters the ear. It's the pathway that leads sound to the eardrum. Imagine it as a tunnel guiding sound waves to their destination. Eardrum, or tympanic membrane, is a thin membrane that separates the external ear from the middle ear. It transmits sound from the air to the bones inside the middle ear. Did you know that a ruptured eardrum can lead to hearing loss? It's like a drum with a hole in it. It just doesn't work the same. The middle ear is the space behind the eardrum. It's where the magic of sound transmission happens. Fun fact, the middle ear contains the three smallest bones in the human body, the malleus, incus, and stapes, also known as the hammer, anvil, and stirrup. Inner ear is the internal portion of the ear inside the skull involved in hearing and balance. It's like the ear's control center. Did you know that the inner ear is filled with fluid that helps you keep your balance? The vestibular system detects motion of the head in space and generates reflexes that help us maintain balance. It also provides our sense of movement and orientation in space. Imagine it as your body's internal GPS. Eustachian tube connects the middle ear with the back of the nose, allowing fluid to drain from the middle ear. It's essential for maintaining ear pressure balance. Ever felt your ears pop on an airplane? That's your Eustachian tube at work. Earwax is a wax-like secretion from glands in the ear canal. It protects the ear by trapping dust and debris. Fun fact, earwax is actually beneficial. It has antibacterial properties. Buildup refers to a gradual accumulation of something negative, typically leading to a problem. In the ear, it often refers to earwax buildup. Remember, a little earwax is good, but too much can cause issues. Q-tip is a brand of cotton-tipped swab used for cleansing small areas or applying medications. Remember, it's not recommended to use Q-tips inside your ear canal. They can push wax further in and cause blockages. Ear discharge, or otorrhea, is fluid that drains from the ear canal. It can be a sign of an infection or other ear issues. If you notice ear discharge, it's best to see a doctor. Otoscope is an instrument for examining the ear canal. It's what doctors use to look inside your ear. It's like a tiny flashlight for your ear. Earache is the sensation of pain centered in the ear canal. It can be caused by infections or other ear problems. Earaches can be quite uncomfortable, but they're usually treatable. Swimmer's ear, or otitis externa, is a condition that occurs when water is trapped in the ear canal, leading to an infection. It's common among swimmers, hence the name. Remember to dry your ears well after swimming. Otitis media with effusion, also known as glue ear, is a condition where there is fluid in the middle ear. It usually doesn't bother children and often goes away on its own. Patience is key here. Ruptured eardrum or perforated eardrum is a condition resulting in an opening or hole in the eardrum. Damage to the eardrum may harm hearing. Protect your ears from loud noises and avoid inserting objects into them. Mastoid bone is a large bone at the base of the skull behind the ear, containing air spaces that connect with the middle ear cavity. It's like a sponge that helps with ear pressure. Mastoiditis is an infection of the bone behind the ear, usually caused by a middle ear infection. It can spread from the ear to the mastoid bone. Early treatment is crucial to prevent complications. Ear barotrauma refers to medical problems that arise from pressure differences between the ears and the environment, a particular concern for scuba divers and during airplane flights. Equalizing pressure by yawning or swallowing can help. External ear squeeze is a type of barotrauma that occurs when the ear canal is blocked by something like earwax. As water pressure increases, the air pocket between the obstruction and the eardrum shrinks, potentially damaging the tissue. Middle ear squeeze is another type of barotrauma that occurs when you cannot equalize the pressure in your middle ear. Always equalize pressure slowly and gently. Vestibular disorder is a dysfunction of the balance organs of the inner ear. It can cause dizziness and balance issues. Balance exercises can help manage symptoms. Dizziness is a sensation of lightheadedness, faintness, or unsteadiness. It can be a sign of a vestibular disorder or other health issues. Stay hydrated and avoid sudden movements to reduce dizziness. Vertigo is a rotational spinning sensation. It's an extreme feeling of the surrounding area, spinning or moving. If you experience vertigo, sit or lie down until it passes. Disequilibrium is a feeling of unsteadiness, imbalance, or loss of equilibrium, often accompanied by spatial disorientation. It's important to find a stable position and focus on a fixed point. Labyrinthitis is an ear disorder involving irritation and swelling of the inner ear. It can cause dizziness and balance issues. Rest and hydration are key to recovery. Meniere's disease is an inner ear disorder that affects balance and hearing. It can cause vertigo, hearing loss, and tinnitus. Managing stress and diet can help control symptoms. Ringing in the ears, or tinnitus, is the perception of noise in the ears without an external source. The noises can vary in sound and intensity. Protect your ears from loud noises to prevent tinnitus. Acoustic neuroma is a non-cancerous growth on the auditory nerve near the inner ear. It can cause hearing loss in the affected ear. Regular checkups can help detect and manage this condition. To pull on the ear or to tug at the ear means to hold onto the ear and move it towards yourself or down. It's often a sign of ear discomfort or infection. A stuffy or plugged up feeling in the ear is a sensation as if something obstructs the ear. It can be caused by earwax buildup or fluid in the ear. Muffled hearing is hearing sounds not at their actual volume, but as if being obstructed in some way. It can be a sign of earwax buildup or an ear infection. Eardrops are liquid medicine designed to be dripped into the ear canal. They can help treat infections and soften earwax. Otologic surgery is surgery performed on the external, middle, or internal ear. It's often done to treat chronic ear infections or repair eardrum damage. Ear tubes or tympanostomy tubes are tiny plastic tubes that help drain fluid from the middle ear and balance the pressure in a child's ears. They can prevent ear infections and improve hearing. Hearing test or audiometric test evaluates a person's ability to hear by measuring the ability of sound to reach the brain. It's a simple and painless test that can detect hearing loss. Audiometer is a device used to determine a person's hearing sensitivity at different frequencies. It's like a hearing test machine. Audiologists are hearing specialists trained to identify, diagnose, measure, and treat hearing disorders or balance problems. Hearing loss is the inability to hear sound, either partly or totally, in one or both ears. It can be caused by aging, noise exposure, or infections. Hard of hearing, or hearing impaired, refers to persons whose hearing is impaired, but who have enough hearing left for practical use. They may use hearing aids or other assistive devices. Deaf means partially or wholly lacking or deprived of the sense of hearing, unable to hear. Deaf individuals often use sign language to communicate. Hearing aid is a small device that fits in or on the ear, worn by a hard of hearing person to amplify sound. It's like a mini sound amplifier. Completely in the canal hearing aid is a device molded to fit inside your ear canal and can improve mild to moderate hearing loss in adults. It's discreet and fits snugly inside the ear. In-the-ear hearing aid, or full shell, is a custom-made device that fills most of the bowl-shaped area of your outer ear. This style is helpful for people with mild to severe hearing loss. Behind-the-ear hearing aid is a device that hooks over the top of your ear and rests behind the ear. It picks up sound, amplifies it, and carries the amplified sound to an ear mold that fits inside your ear canal. This style is appropriate for almost all types of hearing loss and for people of all ages. Open-fit hearing aid is usually a very small behind-the-ear style device that leaves the ear canal open. Sound travels from the instrument through a small tube or wire to a tiny dome or speaker in the ear canal. This style is best for mild to moderate high-frequency losses where low-frequency hearing is still normal or near normal. Earmuffs are a type of personal protective equipment that covers the entire outer ear, consisting of 2 ear coverings connected by a band and worn over the ears to protect them from noise or cold. They're great for keeping your ears warm in winter or protecting them from loud noises at concerts. That's all for this episode of Vital Terms. I hope you enjoyed learning about these essential ear-related terms and the incredible ways our ears help us hear and maintain balance. Until next time, stay healthy and keep listening.